Welcome, Natalie. Thank you for being here and being willing to share your birth story.
Yeah, thank you. Thanks for having me.
So you have two beautiful girls. You're in Syracuse, New York, and you have your youngest is 5 months old.
Yes, that's
All
correct.
right. So I wanted to talk with you about your story, especially because you had so much that you had to navigate that was unexpected by the sounds of it in your second birth that you didn't deal with your first. So you mentioned having low amniotic fluid. You mentioned having to be induced as a result of that, needing a tube put into your uterus to help because baby's heart rate wasn't liking that there was low amniotic fluid, like all sorts of stuff. So
Yeah.
I would love to learn a little bit more for everyone listening too. Like, what was that like? What actually can you maybe you can start from there?
So yeah, everything. I mean, I up until that point where I found out I had low AFI or amniotic fluid, everything was fine. All the visits, all the checkups, everything was normal. I was dealing with severe back pain starting around month 3 of pregnancy up until delivery. It was excruciating. I was barely able to walk. But other than that, everything else was fine. So at the 36-week appointment, when they do the sonogram, the physician assistant goes, well, your amniotic fluid is low and it's a little lower than we'd like it to be, she said to me. So we're going to send you to the hospital to get some IV fluids. Um, but she didn't make it seem like it was a big deal.
Mhm.
And I don't think she wanted to scare me. So she said, we're going to send you to the hospital, just get some fluids, and hopefully that'll fix that. So I said, okay, well, let me go home and grab a snack. She's like, no, 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 you're going right now.
Oh, wow. Okay.
Yeah, we're going to call labor and delivery and we're going to tell them you're coming. So I was like, okay, all right. So that's when kind of like hit me like, okay, maybe this is a little bit more serious than I'm thinking. Um, and I went to the hospital, they hook up the line. And then after they did the IV fluids, they did another sonogram and the levels did had come back up. So they said, we want to recheck in 3 days. So I did that. I went home, kept my fluid levels. I kept drinking water, thinking maybe this will help staying hydrated. And at the 3-day checkup again, the fluids were low again. So they sent me a second time to the hospital. So at this point, I had already done a little bit of research and to figure out what the concerns were. And I hadn't even seen my doctor at this point in my pregnancy. I've been dealing with my physician assistant and the nurse practitioner at the office, which they're both great. So I didn't really have an issue with that. But at this point, I said, okay, I think I want to talk to the doctor because it kept sounding like it was getting more serious. So when I finally was able to talk to him, which was also another thing, I had to be like, listen, I'm having this baby in less than 2 weeks, hopefully. I need to speak to the doctor.
Yeah.
Okay. I know he's busy, but I need to talk to him. So, um, and he explained the concerns, if your amniotic fluid is low, the baby's not going to continue to grow. There can be other complications, this, that, and the other. So if the levels keep dropping, we're going to have to do an induction. And it was a little scary because it was definitely not something that I anticipated. And I was concerned because induction doesn't come without risks
Mhm.
either. So, but I do feel like that decision was kind of made for me. And I wish looking back, I would have asked more questions. Perhaps if maybe I asked more questions and advocated in that sense a little bit more, maybe it would have happened differently. But he said, no, I'm not going to keep sending you to the hospital to get IV fluids every time we do a sono. You're already technically full term. I was 38 weeks at that point. He said, we're going to do an induction. We're going to induce you and, the baby will be here and then things will go from there. So that was definitely a little unexpected
Yeah.
road I had to go down to. But yeah, and I didn't know at that point, like I said, I feel like my hands were tied because I didn't know what was going on with my baby. She was fine. She wasn't moving as much as my first baby. She was always moving. This
Mhm.
one was always kind of on the quieter side. So then I started to worry that if I didn't feel her moving, that it was because something was wrong with her.
Mhm.
So at the end, I said, okay, well, if he thinks this is what's best for me and the baby, then we'll go that route. But yeah,
When was your first baby born? How many weeks were you?
she was right at 40.
Okay. So this felt
Yeah,
very early then for you.
it did. It
Yeah.
did. Yeah, and she was on the lower end of the weight, for her gestational age. She was, her weight was a little lower than they would have liked it to be. Um, so the whole thing, it was just like, okay, so my baby's really tiny. She's full term, but technically I didn't feel comfortable,
Yeah.
you know. So yeah, it was definitely different in that sense too.
So you go in for the induction at just around 38 weeks.
Yeah.
And how did it happen?
So I went in there, mind you, like I said, I was already in so much pain.
Mm,
I had decided at that point that I wanted an epidural
mhm.
because I didn't get one. I had an unmedicated birth with my first. Everything, it was a completely different experience. So, but I was miserable, and I didn't think I had the physical strength
Mm,
to do an unmedicated delivery because I had already been, suffering with back pain. So I kept asking. I told everyone I want an epidural. When can I get that epidural? So I made it clear when I got there that that was what I wanted to do. So they said, well, once the balloon, because they decided to use the balloon
yep.
for the induction. When the balloon comes out, you can get your epidural then. So, you know, they came in, they hook up the IV lines, all that stuff. The doctor came in. Actually, a resident came in. She was very nice and she explained. I said, what's going to happen? Um, I'm not comfortable with this, never happened because it's new. I didn't know what to expect. So she was very nice. She explained the whole, process. This is what's going to happen. I'm going to place the balloon. Um, and they offer medication. So at that point, I think they said, if you want morphine, we can give you morphine, which I denied. I said, no, I don't want anything for pain right now. And that was the other thing I said, is this really going to hurt that bad that I'm going to need morphine?
Mhm.
And she said, oh, no, it's not going to be any more uncomfortable than when I do an exam, when we do um, the exams to see if you're dilating. I said, okay, if that's the case, then I think I don't need the morphine. Um, so she did she placed the balloon, and then they came and checked periodically to see how I was doing. And eventually the balloon came out, and I said, well, can I get my epidural now?
Mhm.
And at that point, the nurse that was helping me, because I had at least, I want to say 5 nurses come in and out, changing shifts and all that. She said, I think you're doing great breathing through your contractions. Why don't you wait? And, I was like, well, I, looking back, I should have said, no, I want that epidural right now.
Mhm.
But I didn't. I didn't. I listened to her, and I definitely, the contractions with the induction are much stronger,
Yeah, everyone has
more,
said that I've spoken to.
way more intense.
Yeah.
And, you know, I thought I could handle it. And I had to. At the end, I had to because I still had to wait to get my epidural. So, what ended up happening was my water broke.
Even more intense.
And yes, so my contractions were stronger. At that point, she turned off the Pitocin. She turned it off because I was in agony. And she said, well, now that your water broke, the baby's heart rate is not stable. So we have to continue give you the fluids and wait for that to kind of, for the baby's heart to settle so we can give you an epidural.
Okay.
And I was very mad. I was very angry at that point. I was like, oh my God, like this is not happening. I'm already in so much pain. I gotta keep waiting. So, and then another resident came in and said, well, because your amniotic fluid was low to begin with, the doctor wants me to put in almost like a catheter or a tube into your uterus to give you fluids that way, so your baby's a little more comfortable in there. So that was another thing that I didn't, see coming, that I had to
Yeah.
endure. It wasn't comfortable at all. But I mean, again, at that point I said, okay, you do what you gotta do. And yeah, so that added an extra layer of discomfort to the pain I was already experiencing. And I had to wait at least almost another 40 minutes between the time they finished to put all the fluids in, the IV fluids, and they finished that liquid into my uterus directly. Um, yeah,
How dilated? Do you remember? Did you know approximately? How,
I was 6 centimeters
okay.
dilated at that point. Yeah, and my first delivery happened within 12 hours. I mean, by the time I got to the hospital, I was already at 6.
Yeah.
Um, it happened really fast. So I was afraid that I'm not going to have time to get this epidural. And that's why I said from the beginning,
Hmm.
I
Hmm.
want it. I want it as soon as I can get
Yeah.
it.
So can I talk to you about that? Because this is a scenario that I think is important to touch on, the fact that, you mentioned that like you had back pain in this second pregnancy, and it sounds like you didn't experience that with your first.
I did not. No,
Okay.
I had a little bit of back pain, which was normal towards the very end of my first pregnancy, like
Okay.
36, 37, and it was mostly, I thought, because of the weight of the pregnancy and all the other changes that happened. But I had so much back pain. It was intense. I had a lot of inflammation. I ended up going to a chiropractor to see if that could help. It did help improve my function because I work on my feet. I stand for 12 hours.
What do you do?
Um, I am a pharmacist. I'm a community pharmacist. So I'm on my feet all day, and I could barely walk.
Oh, that's hard.
Yeah. So the chiropractor did help with improving not necessarily my mobility, like more like the pain it never went away till I had the baby.
Okay.
And yeah, so I experienced pain. It started around 3 months and it just got worse and worse as I gained weight.
And so would you say, the main reason that you were very much like, you knew that you wanted to have a different experience? You wanted almost like a bit of a break from the intensity of the pain, the
Yes.
epidural
Yes.
this time. Okay.
Absolutely.
Yeah.
Yes.
I think it's important people to hear that because, there's almost like this idea that once you have had one maybe that was something that the doctors and the nurses were making these comments, like, you've already had one unmedicated birth, just do it again. But the fact that you're coming into this second birth already almost at a deficit because of the pain that you've been experiencing now for months on end, plus an induction, which is more painful, which you said, plus tubes in your uterus, like plus a balloon, all of this stuff. So yeah, it's a different, you can't compare the two experiences.
Not at all.
Yeah.
So yeah, and that's why, I kept talking to my OB throughout, like, the physician assistants and the nurse practitioners, and I said, I think I want that epidural when the time's come because this pain is getting worse and worse and worse. And she said, you'll know, like she said, you'll know what's best for you and what you need to make this happen. But I knew, and I discussed it with my husband because he was there the first time, and we were mentally prepared to handle that pain, with the first delivery. Um, but when it came to my second one, I was like, I don't think I can do it physically. I don't think I can do this without the epidural. Um, so yeah, I went in thinking this is what I want, and I told everyone. I told the nurses, I told the doctor, everyone, and it just felt like I wish I would have said no. I want it now. Give me
Mhm.
that epidural. Call the doctor. I want it now because when I got the epidural, it was just so funny. I felt such relief,
Mhm.
you know, and 20 minutes later, my baby was born.
Oh my gosh. Wow. And this just goes to show,
Literally.
sometimes like people often say like, oh, the epidural is going to slow things down. But in your case, like, if you're in such pain that you can't really like soften, yield, let go, like you needed that in order to let go, right? Yeah.
Yes. He came in, he put the epidural. It was really funny. I remember telling my husband, he said after the fact, "Did you read that paper that they gave you to sign?" And I said, "Oh yeah, 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 it can cause stroke and death and all this
No.
crazy side effects." It's agonizing. I'm like, "I don't care. I'm gonna sign whatever you give me right now, I'm gonna sign because I need this pain to go away."
Oh my
But
god.
yeah, so they did the epidural, and they said, "You're ready." Like literally, she was born 20 minutes later.
Wow.
So I got on my back, and honestly, at some point, I remember a nurse asking if I wanted to get on my side, to kind of like relieve some pressure. But I was just so uncomfortable. I was like, no, I don't want to move. I just This is how I want to be. So
Mhm.
I did ended up being on my back, and the doctor came in. They set up, and two pushes, she was out, and it was great. It really was a good feeling. But I remember with the first push, she crowned, and then I pushed again, and she was born.
That's
So
amazing. You
yeah,
mentioned something about the breathing piece in your form as well.
yes, yes. So I remember when I was pushing, I kept my mouth open, so I was kind of like, I didn't do the
Yeah.
purple pushing, and one of the nurses in the room kept telling me to hold my breath.
Mhm.
And in that moment, and I told my husband, I have to tell Nikki this because I thought of you. I really did. I'm birthing my child. I thought of you. And I ignore her. I totally ignore what she was telling me. I kept doing because it felt right. It felt good. What I was doing, it felt that was the right way to do it. And I didn't listen. I just kept pushing the way I was doing it. And and my baby was born.
That's amazing.
So yeah, yeah.
How
So
was would you say pushing? I would love to ask you how pushing with an epidural for you this time compared with pushing with your first when you didn't have an epidural, and you hadn't done the course with your first either, so I'd love to know the difference.
yeah. So the epidural didn't really, I felt the pressure. I felt everything, just not, that intense pain from the contractions.
Okay.
So, because I asked the doc, if you push this button, you get more doses or whatnot every so often. But I felt like I had full control of my muscles in the sense that I could still engage
Yeah.
and push. So, not a lot of difference in that sense, because I felt it all. I mean, it happened so fast. I didn't think I get
Yeah.
a lot of doses in, um, but yeah,
Oh, that's
yeah,
amazing.
yeah.
So, what would you say to anyone who is listening to this, watching this, who is pregnant and currently experiencing a lot of back pain in their pregnancy?
I would say don't wait like I did till the end to look for help, because maybe if I would have gone to the chiropractor earlier, I would have been able to, and get help too, like get your body moving. And I did try too, but I felt like certain exercises worsen the pain. So know your limits when it comes to that too. You know what I mean? Don't overdo it.
Mhm.
Um, and also, it's okay if you want an epidural. It's okay. Like for me, I struggled with that for a minute because I didn't have that with my first child. Um, but yes, there are things that you can do to help lessen that pain. I mean, I even think I had a pelvic griddle at some point to kind of help me with the weight of the belly.
Mhm.
So there are things that you can do, um, and look for resources, I suppose, to help you navigate that pain through pregnancy because, yeah, it's no fun for sure.
And what would you say, ask this question to everybody, if you could go back and talk to your pregnant self?
I would say read that pregnancy book one more time, the second time around, because for me, there were a lot of things that I forgot.
Mm.
And maybe if I would have read that section about the AFI and what it really means and how it, affects the decision making when it comes to induction, maybe I would have had a different. I had a really good book that I read, with my first pregnancy, and it made me feel at ease with the decisions that I was making because I felt informed.
That's great.
So yeah, so definitely absorb as much knowledge as you can because it'll make a world of a difference,
Mhm.
when you have to make a decision. And even if things change or something takes an unexpected turn, like it did for me, you will know the tools. You'll have the tools to say, yes, I'm comfortable with making this decision because I know what things are about. Um, especially breastfeeding.
Yeah, you
Like for
mentioned that.
me, my first time around, I couldn't breastfeed past like 5 months. I barely had any milk. It was mentally very frustrating, because I wanted to do this for my baby. And now I know that I did everything wrong.
Mhm.
I had a doctor tell me to pump 3 days after I had my baby. Her bilirubin was really high. So they were concerned. They had to send her back to the hospital. So she said, why don't we supplement with formula and pump to stimulate, your letdown? And what nobody told me was, and I didn't know, that I didn't have to keep pumping when my milk came out. I should have just had my baby feed and see how that went. And there's so many things, things like flange sizing.
Oh, yeah.
I had the wrong size the whole time. So it was so painful for me to pump to begin with. I was getting no output. I did everything wrong, like I said, and I thought I was doing everything that I was supposed to feed my baby. And I ended up doing a little bit of both. She would feed at the breast, and then I would give her the bottle. Same things like time your feeding sessions. Don't time your feeding sessions because that did me a disservice.
Mhm.
Everybody's letdown doesn't happen at the same time. So if you're only feeding your baby for a few minutes, like you might miss that opportunity to
Right.
to feed the baby. So educate yourself, find as many resources, talk to people who know about breastfeeding if that's what you want to do, you
Yeah.
know, to
Yeah.
give yourself the best chance, and if things don't work out, then you can make whatever choice works for you and your family and your baby. But for me, it made a world of difference. Like all the things I learned the second time around about breastfeeding have made it much better.
Oh, that's great.
Yeah, so definitely, I would recommend anyone to look into that before
Mhm.
you need to start pumping, before you need
Yeah.
to start doing all these things.
Yeah, it's so important, and I feel you as someone also who struggled with my first, so that's we have the did you listen to the Carrie Bruno interview on the in
I
the
did not. No, no, I
Oh, you
haven't.
didn't? Oh,
No.
it's in the dashboard, the harvesting colostrum and all of
Oh,
that.
no, 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 no. Yes, that one I did. Yes,
You
I'm
did,
sorry.
okay.
No, I did because after that interview, I did start to harvest
Oh, you
colostrum.
did? Okay, amazing.
I did, and I remember, when my second was born, I asked the nurse right away. I said, "Can I have a cup, and a few syringes so I can start?" And I did.
Amazing.
I hand expressed in the hospital, and, I fed the baby that because she was so little that I was afraid she wouldn't latch right away. So I said, "At least I'll have this to
Sure.
to give to her," and we did. So, yes, that one I did listen to, and it was amazing. She's great.
Yeah,
I follow her on Instagram after that, and
yeah,
again, whatever resources, you choose to go with, find someone who knows, who can guide you and give you good advice to help you. But yes, I did listen to that interview. Yes.
yeah, there's a lot there, I know.
Yeah.
Oh,
Yeah,
man. Well, I'm
but
so happy for you, and I mean, you've not you know, the advocating piece, I hope that's something my hope is really that we can learn not just through birth, but through life, especially, a lot of us have been conditioned to sort of be nice, be polite, don't be difficult, blah, blah, blah. And,
mhm.
and it's like, no, you have to find your voice. And it doesn't mean be disrespectful. You can be firm, but you can be polite, you can be informed and educated. So
Absolutely.
that's it. Yeah.
Yes. Yes. I think you do a great job. I love your content. I tell everyone, that would listen. I have a friend who had a C-section and I said, you got to go follow Nikki and and her tips and it's great. I think the more we can do this for each other too, like you said.
Yeah.
having the knowledge to say, no, that's not what I want to do. Can we talk about this other thing? And having a voice, definitely.
You got to use it.
Yes.
Thank you, Natalie, so much for sharing your story.